Okay, I'm back with your nursing tip of the week. Today we're going to cover some charting do's and don'ts because I feel like charting is one of the most difficult things for new nurses, even experienced nurses, to get down. Let's start with some don'ts. So first thing is don't say will continue to monitor. This is just a filler statement. It's unnecessary to say, and it can put you up for like some liability. So let me explain. First, if you say will continue to monitor, you're charting in the future. We never chart in future tense. Also, you're not saying what you're doing to monitor, and you're acknowledging that there's some sort of change in condition that you will continue to monitor. But did you notify the physician? Like, what are you actually doing to monitor the patient? That's what you should be charting and not using the future tense. Okay, next is don't chart a symptom such as complaints of abdominal pain without also charting how it was treated. So you gotta do how it was treated or what was done about it or what was not done about it. You know, for example, notified provider, patient complains of abdominal pain, order received for CT of abdomen, pelvis. Okay, let's cover a couple do's. Do make sure you're in the right chart. Duh, we already know that. Do ensure documentation is in a line with your professional license. So make sure you're not charting things that you are not allowed to do. For example, I'm a nurse. I don't intubate patients. I'm never going to chart that I intubated a patient myself. Okay, if you want all the rest of these, I have this chart that you can download for free. It's linked in the you know where. And yeah, let me know if you have any more questions.